How do we prevent skin breakdown? What are the basic principles of skincare that can minimize the risk of skin breaking down? That's the topic of this video. I'm Chris. I'm a registered nurse and ordained minister. I specialize in hospice care, and I want to jump into this video and just share some thoughts and some ideas that can help you with your loved one better protect them from skin breakdown. First thing I want to go over is about my very first rule is that everybody, whether it's by chronic disease or age, they can't care for themselves, but everybody is worthy of dignity and respect. And any care that we provide, we want to provide with the utmost respect and preservation of their dignity, and know that every person, if they could take care of themselves, they would. They're just in a state where they maybe can't anymore. Maybe they're what we call total care. They can't do anything for themselves, or maybe they need a lot of assistance and they couldn't do it without that assistance. But nonetheless, that first rule is just so important that what we want to do is preserve dignity. We want to show respect in all the care that we provide. So I want to go over a few things real quick. First is, I always recommend that you use baby soap without a lot of dyes and perfumes and any kind of skin irritants in there. Baby soap is just a gentle way, and I would always bathe person using baby soap. The other thing with that is once you're done helping bathe somebody, whether they're sitting on a chair in the tub or maybe you have to do in the bed, or however you do it, you want to make sure that they're dried off thoroughly. Now, if they're overweight, kind of like I am, there'll be spots where the skin will fold over and you'll get the moisture and the water up in there. And then if you don't get that dried out really good, what happens is that covering the skin kind of holds the moisture in, and the warmth, it's just a breeding ground for bacteria and fungus, and you'll have irritation that will come out of that. So you really want to pay attention to the folds of the skin in areas where the skin is laying over skin that's moist. Another thing is you want to keep the skin from getting too dried out. Dry skin is not good, especially when somebody's moving around in the bed. If it's too dried out, if there's no stretch to it at all, it's very easy for it to tear, especially in those of advanced age or those that aren't getting proper nutrition. Getting the right hydration, getting lots of water, and eating especially high protein foods will help. But the other part would be to take a skin protectant cream, like something with a vitamin D zinc base, and some Vaseline. And I've learned this from our very experienced home health aides, is what they'll do is they'll mix that together, and it just works wonders in helping keeping the skin flexible and soft, and having that stuff in it that kind of helps guard against skin breakdown. Now, you don't want to overbathe somebody like multiple times a day or even daily. Sometimes that can do more harm than good. You just want to make sure that you're keeping them clean and dry. Another thing that happens when we're older is we lose muscle mass, and often as our appetite goes away, and that's a normal part of aging, a lot of people start to lose weight. And so you have less cushion, less fat, you have less muscle, and you have the bones closer to the surface of the skin. And so if somebody's laying down in an area where there's the bony part of the skin, like the backbone, the tailbone, the hip bone, a lot of times the heels, it will happen there as well. If it's just pressing against that, they're moving around a little bit, and it's just rubbing against this hard surface, that bone and that hard surface together will just wear right through the skin, and you'll end up with a pressure injury. So what we want to do is we want to, elevate heels, put a cushion under the heels, or put pillows different places, or try to find a way to cushion those spots where the bone is kind of sharp and pointy up against the skin, and when there's a hard area. And you really want to also think about moving a person, because another way that skin breaks down is the loss of blood flow to a certain area. So if they're laying in the same spot, and all those surface area little blood vessels are restricted in blood flow and you don't move them, then you'll have skin breakdown again. So we talk about turning a patient, moving them, helping them change positions. One thing that you can do if somebody is still able to safely stand or maybe walk, 10 feet or 5 feet with a walker with assist, if as long as they can safely do it, don't do this if somebody can't safely do it, but if they can get up and maybe walk to a chair and walk back every 4 hours to bed and change positions and everything, that will also help with blood flow and will help reduce the risk of skin breakdown. We just don't want people to be in the same spot too long. Another big one, especially with incontinence, is you do not, especially with urine, you do not want a patient to be laying in urine too long, or even feces. So when they do have have a urination event or a bowel movement, you want to go ahead and clean them up and put something dry and clean on right away and not wait on that, because it can have an impact. And I know it's a lot. Sometimes it's a lot of hard work, because sometimes you're changing diapers 5, 6, 7, 8 times a day, and it seems frustrating that you have to do it so often. But if you do that and you keep the skin dry, you keep the skin clean, you will have a lot less issues, a lot less risk of skin breakdown further down the road. And it can be a very painful thing to have the skin breaking down. And then there's when the skin breaks down, there's also risks of getting systemic infections. Infections are very hard to keep somebody from getting an infection once they have a lot of skin breakdown. And that infection can get in the bloodstream and get a condition known as sepsis, systemic infection that just overwhelms the body. So we want to really be careful about protecting as much as we can for skin breakdown. Now, I'm going to tell you this, and this is a reality that I see all the time in hospice care, is I see so many families do the right thing and there's still skin breakdown. And that's going to happen. We can do the best we can in the right thing, and there will still be skin breakdown. It's not a reflection on your care. There's no hospice nurse I know that would walk in and immediately cast judgment on somebody that has a loved one with pressure sores, because we simply don't know, because so often you can provide the best care possible and the skin will still break down. Now, if you're a home health or hospice and you do have a loved one with skin breakdown, you want to ask the provider about low air loss mattresses, about alternating pressure mattresses, or anything that might be able to assist. Especially, I would say, if you have a loved one who is very obese and hard to turn, I would have that discussion with home health or hospice agency to see about getting a mattress that would help reduce the need or to turn if you just physically can't do it. Always be honest with your struggles with those healthcare providers, because they're there to help you, and they're going to want to do the best they can to make things so that you can care for your loved one in the best possible way. And the goal is never to be judgmental or look down on anybody, but it's to take care of the patient, take care of your loved one in the best possible way. And that's what we're all on the same page. That's what we're trying to do. And I would encourage you, again, if you have any questions, if you need any resources, I know the agency I work for, our home health aides absolutely love to show caregivers how to bathe and turn and take care of a patient. It gives them joy. It makes them feel better about the patient that they're caring for, to know that when they're not there, that patient is still receiving good care from their families. And nurses are more than happy to do that as well. We're all on the same team. And I would encourage you to think about that. Or maybe if you're struggling in the care of a loved one and they're not on home health or hospice, to maybe make an appointment with a provider so you can bring them in and discuss their needs, their health care needs, and maybe see about getting some of these services in place. I guarantee you it will be a great blessing to you to have services in place when you need help with a loved one. This is Chris, Pastor Chris RN. I'm a registered nurse and ordained minister. I'm just glad that you're here watching this video. Please comment below. Please like this video. That would be the biggest help for me, because I'm really wanting to get a community going where these videos get posted and people engage in conversation and we can all learn from each other. So I'd encourage you to do that. Stay around for the next video. We'll be talking more about practical care tips on this channel more and more as I get a chance to make videos. Anyway, let's make beautiful sunsets for our loved ones together.